Good afternoon, everybody. How are you? Welcome back. I apologize for not having my musical opening, but today is a special treat. I have here Dr. Cook. He works out of Hope Clinic here in Ypsilanti, Michigan. And Doc, can you give us a location?
Yeah, Hope Clinic is located at 518 Harriet Street in Ypsilanti, Michigan.
So, Doc, I remember a while ago, I mean, it's been some years, you had your own practice and then you kind of, retired a little bit and relaxed in life, but you decided to come on back. Tell me why you did it.
Well, I was young enough to still be able to do dentistry. And once you start doing dentistry, it's sort of hard to stop. You have so much fun and you can help so many people. So after I sold my practice in 2019, I continued working at the Department of Corrections until about 2021. Then at that time when I retired from Department of Corrections, I started working at Hope Clinic here in Ypsilanti.
Okay, that's fantastic. I know Hope Clinic is known for helping people who are not basically able to maybe, excuse me, pay the full price of what a dental service will cost at an average dental office. So can you tell me how that sliding scale works for people with minimal income to no income?
Well, there really is no sliding scale at Hope Clinic. Hope Clinic is a totally free dental clinic. All the services we provide at no cost. We are a clinic that is only for the patients who don't have any insurance, the uninsured, and are 200% below the poverty level. So we're treating people who have no other resources to spend toward their medical, dental, behavioral health, food insecurity. We have a number of tentacles that reach out into the neighborhoods and meet people where they are.
And I love the fact that you guys meet people where they are. So for my audience, let me just say this, and the reason why I asked Doc to come on, Dr. Cook, to come here on the K-Man for Peace show. A personal experience of my own, attempting to get a root canal just prior to COVID shutting down. Of course, as everyone knows, resources and money were very scarce, and that could cause a number of issues. But to have a tooth that's being worked on but not finished during that time can be a scary process. And as you all know, right here, right now, today, we're having, some political challenges facing us regarding taking away social welfare and the things that we need to function. But just going back to the personal experience, I had a tooth that was being worked on, and because of the COVID and shutting everything down, it was just packed. So it hadn't had the crown yet. When this happened, even though it was packed and was supposed to be secure until they could get to it, I had a hairline fracture in my tooth, which caused this side of my face to kind of blow up like this. And to speak to why I asked Doc to come here, the importance of that matter is that if that goes untreated, or any kind of dental work that gets very serious and you're swelling, you have your main arteries here that lead to your heart. And I went in, I happened to get let into an emergency room for here in this area to be seen because of it, and it couldn't wait. And what I was told after being examined and x-rayed was that I had 24 hours to live. That's how serious it gotten. Even with the medication I was on that was supposed to help keep this at bay, it still was not enough. So had I not gone in, I probably would not be here talking to you today. But the importance of the matter is that taking care of your dental health is overall important for your entire being, and especially your heart. So to that, I want to ask Doc, what is it that people can do besides flossing and brushing and before bed and getting up in the morning, that if they have a situation and in their area can't come to Washtenaw County to receive help, how do they reach out in their own local areas? Where do they call if they should find themselves in that kind of position?
Well, local areas are set up so that they almost always have some access to dental care. You have the dental schools that are spaced around. You have U of D in Detroit, out that way west of here. Make that east of here. And then west of here, we have the University of Michigan Dental School and those associated hospitals. The hospitals have residents that are trained in dentistry and are learning to specialize in forms of dentistry, and they can help. They can also refer you to free clinics. There are free clinics in Detroit. Just off the top of my head, I can name the Huda Clinic, which is near Linwood and the Lodge Freeway, near the Detroit Repertory Theater, for folks that know Detroit.
Okay.
And then you have the Malta Clinic, which is in Detroit also. The Malta Clinic just moved, and I'm not exactly sure where they are. I hear they're in the North End part of town.
To interrupt you for 1 second, how is that name spelled?
Huda is Huda,
Okay.
and Malta is Malta. They both have nice websites that you can check out and make contact with them through their website. If you're seeing this and you're not here in Ypsilanti or Ann Arbor, close to the Hope Clinic.
Okay. Quick intermission, audience. I want to say that there's a spectacular event that's going to be happening September the 25th. And for those of you who care dearly for your loved ones, especially our men that hold us down, here is a men's health, and you probably can't see it, but my editor's going to help you out. It's a men's health event 2025. It's the 15th annual. So this just spells out how long it's been around. And it's a shame that everybody doesn't know, but Saturday, September the 20th, 2025, 9 a.m. until 3 p.m. at Ford Field in Detroit. There's free men's health screenings valued over $2,000. There are high blood pressure checks, prostate cancer checks, but it's not with you taking your clothes off. They can do it through your blood exam, as Doc had explained to me prior to our filming. There's colon cancer check, diabetes, oral cancer checks, which means they can go through your dental area and find out whether or not it looks to be suspicious and give you some informed information to help you get your access to some health, to get you some help. Skin cancer, heart disease, HIV, and more. There's going to be free lunch for the attendees, free haircuts for men, and there will be a job fair as well. I don't know if that you can see this QR code here, and it's kind of difficult to kind of,
Sure.
if you can see that, and if you can scan it. If not, September the 20th, 2025, call Ford Field, ask for more information, or just show up on that day. Back to Doc. Doc, I want to ask you, what made you decide to get into dentistry? And if I were a young person looking to get a curriculum going after I'm out of high school, where do I start?
Okay, the reason I went into dentistry is because I loved to fiddle with things with my hands. I took apart things at my house. I took all the radios apart, and I couldn't put anything back together.
Okay.
But I took a lot of stuff apart.
Okay.
And so I really like to use my hands. And then when I got a little older, I got into model rocketry and model cars and just all these little things that I used to do. And then when I went to high school, I went to Cass Tech High School in Detroit.
Okay.
And found out that they had, that I wasn't too bad in the sciences. So I did a lot of science classes there, which prepared me for college, and went on to Wayne State and majored in biology there, and sort of knew that I wanted to go into dentistry because of the ability to use my hands on small things, and I figured the mouth was a small place, which turns out it is.
Okay.
And that's what got me into thinking about dentistry.
Okay. So if I'm a young person and I want to get started, do I talk to my counselor? Do I talk to the guidance counselor? Or do I go to someone like yourself and say, hey, can you mentor me and walk me through this? Can I do it that way? Or
You do all of that. You do all of that. You talk to your counselor at school, depending on where you're at. If you're in high school or in middle school, you talk to your counselors, and they can sort of tell you what to lean towards. You don't have to be a biology major or a chemistry major, but you do have to hit certain courses that are requirements for dental school. So make sure you're good in the sciences, and then once you do that, all you have to do is they want you to have about 100 hours of over-the-shoulder observing with the dentist. And at Hope Clinic, we make it very easy to come in and do the over-shoulder observation that you need, because they instituted that because a lot of people were going to dental school only to get into like the third year into the clinical aspect and then figure out, hey, I don't like the sight of blood. I don't like working in people's mouths. I don't like this. So if they make you do 100 hours of clinical observance, you see about everything, and you'll figure out whether you want to go further into that field or if you want to find another field to go in that's related.
now, somebody just came to my mind. This young man that I was going to interview as well, and he's going to school actually, and I believe he's gotten some time in, but now he's afraid that the student loans will prevent him from actually doing what he loves, and it's in dentistry. It happens to be. And I just wanted to know when I bump into him again, is it okay if I bring him over to your office or just refer him over to you? So maybe you can give him some ideas, because I think it would be a great waste of a great talent for him not to go. And he really loves the work. He loves doing what he does. And he's just saying that the cost to go further is just so astronomical that it feels that he's going to be burdened down with more debt than to be able to enjoy the work that he wants to put in and then be able to still thrive and be successful.
And I know young people think when you hear about you owe something, you think about you have to pay it back right away, but financial institutions understand that dentistry is a long career. I've been practicing dentistry over 30 years.
Wow, that is fabulous.
Have been able to pay off my loans. And it's not like I paid off my loans 20 years ago. I'm just now finishing up paying my loans.
Okay.
But you're making money, you're doing well, and it seems to be a lot on the front end, but after you get into the field and start making money and paying those loans back, that all sort of fades into the background.
Okay, and that's what I was attempting to convince him of, because like I said, he's a honor student. I mean, I see the ropes everywhere. I'm like, oh my God, why do you want to quit? Don't quit.
Don't
I
quit.
said, do you know how many kids will look up to you and say, I want to be like that. I want to do what you're doing. I said, but to have that, it was nothing that I could give him in terms of experience to convince him to stay with it. But I just find that more of the children that come from our neighborhood are not going into the fields that they would like to go into because they're afraid of the debt that's involved after the schooling's over.
That sounds like the perfect person I'd like to talk to. When I talk about the over the shoulder, that's actually called shadowing. So have him come into our clinic, and he can shadow myself or he can shadow Dr. Pam and just see what we do. Right now we have two fourth-year dental students who we are mentoring through all types of treatment. Dr. Pam usually works with the students on restorative dentistry, and I work with the students with oral surgery.
Okay.
And so between the two of us, you get a pretty well-rounded experience about what you're going to do in general dentistry.
Okay. So now let me ask you, have you guys gotten into the 3D printing yet?
You know what, it's funny you asked that. We were talking about a 3D printer just last month. We're in line for a grant, and that's one of the things that they said we could use that for.
That'd be fantastic.
We would have to change some of our policies because 3D printing, we would have to start doing crowns. Right now, we don't do crowns because of the costs associated with sending the crown preps, the impressions out to a lab to get the crown fabricated. But if we can fabricate our own crowns right in-house, that's a game changer.
You hear what I'm saying? And let me just tell you why I asked that question, because, and just to allude back to the story I first told about my own experience, and it wasn't just one root canal, but I had to have another on one side. And so what happened was that one maxifoliation visit, it was like, oh my, I can't do that. That's kind of expensive. But then I was referred over to U of M, just as you stated, another school, and I found that it was a little bit cheaper. It was still a high price, don't get me wrong, but $800 for them to just do that part. And now that's not talking about the root canal and all the money to come with that, but just for that, because everybody else wanted $1,200 and $2,000, and they wanted to have to send it out.
Sure.
But they were like, well, no, come on over here, and again, audience, let me just say, everybody does not have a payment plan. And sometimes they say, well, we'll do a payment plan, but we won't half up front and half when we finish. So I had to have
Right.
half up front, half when we finish. So I had to, finagle some things. But overall, it was fast. It wasn't like, okay, we'll see you in a couple of weeks. I mean, they went and said, okay, come on, sit in this chair. And all of a sudden, I'm like, oh, so what y'all doing? They said, we're making your crown. And I say in about a half an hour, they had it made. And so in between those weeks of having, the root canal done and all this, going in there in that instant and them doing the crown, I said, well, so what's this machine? Oh, that's a 3D machine. And Doc so-and-so will be in here with his computer in a minute. And and the next thing you know, hey, I was like, how long can before I can eat a piece of steak?
Yep.
And so when I left out of there, I had a piece of steak. I waited a couple hours, though. I didn't want it to come out. And it's been some years, and it's lasted. And I think that's a great idea to have that, as opposed to the things and the cost and the steps that it takes to just get a regular root canal, then a crown, and then you have to go out, then you have to wait, and then you're kind of scared when they pack it, and what if I bite something and it comes out, and you all this worrying that you're doing before you get to the last step. So that would be great if they can put a rush on that, because it would save a lot of people a whole lot of time. The other question I had, Doc, is what's the address to Hope Clinic for those who live in this county? Is it just Washtenaw County that you guys serve, or is it anybody that happens to say, hey, look, I'm here on a visit, or I'm homeless, or whatever the case may be, can I come in and get some work done?
Sure. The address is 518 Harriet Street, and we're in Ypsilanti, Michigan. We don't have any restrictions on who we see, other than they can't have dental insurance. So if you come in, if you're from Lenawee County, if you're from Wayne County, wherever you're from, if you're from Milwaukee, Wisconsin, we will see you. We do see people by appointments, and right now, this is August, almost the middle of August. We have 2 more weeks before we start seeing routine patients for exams. Right now, we have so many. We were backed up there for a little bit, but we'll open our enrollments back up on September the 1st.
Okay.
So on September the 1st, all you have to do is call and get into our schedule, and we will see you for an exam. Emergencies we see almost immediately. You call for an emergency, and that's with the understanding that with an emergency, the most likely outcome is to have a tooth removed. We don't do fillings on emergencies. If you can have a filling, you need to wait. We consider that routine treatment. We do not do routine treatment on emergency. visits.
Okay, so what's the phone number that they can call for a regular appointment, and then what's the phone number for an emergency appointment?
It's the same number. You would dial 734-484-2989, and the front desk will be able to talk to you and figure out what you need. If you need if you're calling about an emergency, they usually patch you right into the dental clinic, and then they'll do a phone evaluation, explain what an emergency is. They'll say, hey, do you think you need a filling on this tooth? And if you say you need a filling, then they'll direct you to our schedule and try to get you in a routine appointment. But if it sounds like you're in pain and you're willing to have the tooth removed, if that's the treatment that it needs, once we take our x-rays and do our evaluation, then we'll schedule you for an exam, for an extraction/exam.
Okay. So I'm banking on that 3D machine coming to the Hope Clinic for Doc, so it makes his job easier. I want to thank the audience. Doc, can you one more time give us the phone number and address to Hope Clinic here in Ypsilanti if you need dental help?
The address is 518 Harriet Street in Ypsilanti, Michigan, 48197, and the phone number to Hope Clinic is 484-2989, area code 734.
And this is Dr. Cook. Thank you, Doc. I really appreciate you coming down, and I thank you so much for getting out of that office as fast as you could. I didn't want to take Doc from any of you because I need him to help you stay with us. Come back again. This is K-Man for Peace. You all have a blessed day.